Mm. Hi, everyone. Good morning, good afternoon, good evening, and welcome to this special session of the Learning for Humanity Community Talks offered by Learning for Humanity and Medicines for Humanity. My name is Esther Rodriguez Miranda, and I have the privilege of coordinating the Learning for Humanity program. On behalf of our entire team, thank you so much for joining us today. We're grateful for the important work that you do every day to serve patients, families, and communities, especially in challenging and resource-limited settings. Today's webinar is titled Beyond Ebola, Infection Prevention, Human Behavior, and Supporting Communities During Infectious Disease Outbreaks. While Ebola provides an important case study, today's discussion goes beyond one disease. Infectious disease outbreaks are not sustained simply because people lack information. Often, outbreaks continue because of fear, stigma, mistrust, limited resources, and human behavior creates barriers that prevent people from applying what they already know. For many of you, infection prevention principles are not new. You have received training, cared for patients during emergencies, and worked directly with communities during difficult moments. Today's conversation focuses also on the human side of outbreak response, why recommended practices sometimes break down, how do we build trust, and how we support patients, families, communities, and healthcare workers during the times of crisis. I am pleased to welcome today's facilitator, Frank Williams Safak. Frank is a psychologist and humanitarian worker with more than 14 years of international experience, leading mental health and psychosocial support, peace building, and trauma recovery programs in conflict affected, post crisis, and emergency settings. He has worked with organizations including UNESCO, UNDP, UNICEF, the International Rescue Committee, World Vision, International Medical Corps, and Catholic Relief Services, supporting communities and frontline workers during humanitarian crisis, including the Ebola response in the Democratic Republic of Congo and COVID-19 response efforts in Cameroon. His work focuses on strengthening psychological support, building capacity among health workers, and helping communities recover and adapt during emergencies. We are honored to have him share his experience and insights with us today. I am surely very much looking forward to what he has to say. Um, as we begin, I would ask for anyone who's here with us to please introduce yourself in the chat by sharing your name, the country you are in, and the organization. And throughout the session, we encourage you to ask questions in the chat, to share your experiences, and reflect on the challenges that you see in your own communities. Sometimes the event can change because of what we see in the chat. So please go ahead and share all of that with us in the chat. I will be monitoring it. And if appropriate, I will pause Frank and address what is in the chat. We will answer as many questions as needed as time allows and follow up afterwards with an email as you already know, recapping everything. And with that, I will turn it over to Frank. Frank, go ahead. Thank you so much.
Okay, so give me a few seconds to share my screen with you so that,
Yeah.
yeah. Mm, okay, just a couple of seconds. Okay. Share. Can you see my screen?
Yes.
Okay, perfect.
It's in
So,
it's in PowerPoint. Yeah, there we go. Now it's in presenter view. Okay.
okay. Okay. So thank you so mumuch, Esther, for inviting me to this session. I'm not going to call it, it's not a training session. This is a discussion. Because I know many of uh, many of you participants have already received a proper training, or let's say technical training on how to address Ebola, and also the different challenges attached to this outbreak, or to this disorder, to this disease. And the purpose here is to discuss some other aspect related to the spread of the outbreak, that sometimes many people doesn't have, or we don't pay too much attention, but it's also have an impact, and a serious impact. Because, for example, if I take the case of the current situation that we have in DRC, uh, we don't have a proper medication. So there is not an approved treatment to solve, the different case of infection that we have in this current outbreak. So are we going to abandon people without any treatment, without any support? We are doing something, but how can we contain? This is the main challenge. How can we contain the outbreak without a proper treatment, without a proper medication? It means that we are going to rely on some other aspect that are, as I said, that are attached to the outbreak, and that have a very big impact on how people are facing the outbreak, how they are dealing with the situation. And now we are talking about fear. We are talking about stigma. We are talking about limited resource. We are talking about mistrust. We are talking about human behavior. At the first point, you may see that, okay, this is can be considered as secondary. But the moment that you see, for example, the impact on the field, you realize that this cannot be ignored. So the discussion that we are going to have is around this different topic, and of course, we are going to, repeat, or let's say do a kind of review of what is Ebola, what are the different elements that we need to know about this outbreak, and also how to deal with. So. Uh, let's say there is something, because there is a big question that we have, because, okay, we have the situation of Ebola. We have people who have been trained. It's not the first time, for example, when we take the case of a country like DRC, it's not their first Ebola outbreak. There have been many I don't want to say session, but many wave, or many wave of outbreak, of Ebola outbreak in DRC. But it seems like anytime we feel like
No, I'm
it is
not
a restart.
stressing.
We are
Not
restarting
stressing
something.
again.
So it means
Uh-uh.
that, oh, please,
Not
Delphine, can you cut your mic? Yeah, please. Thank you. So it seems like every time we are restarting everything from the beginning. And now we are questioning ourselves. People know what is Ebola, but sometimes they even act against it. But why do we continue to see the spread of infection? We continue to see um, the number of cases increasing despite all of this. And then we have to realize that there is a gap between what we know and what we do about it. So this is the main point that we are going to discuss here: the knowledge and the action. Because you may have you may receive many training on Ebola. You may know everything about Ebola. You know the infection, how it goes from a person to another person, how people are infected, how to prevent it. But now, if you don't act properly against the outbreak, then unfortunately, despite your knowledge, then we are going to see that the situation remain the same. People are infected, people are dying, and there is no change. So we as human relief actors, These are the main things that we are realizing, because we realize that, okay, in 2018 to 2021, if I can say it like that, we were responding to Ebola outbreak, sorry, in North Kivu and South Kivu as well. But now, when we came to 2000, when now we come to 2026, it seems like we are restarting everything. The last time I was there, when, okay, it was a couple of weeks ago, I realized that it seems like nothing has happened. It seems like we have not done anything since the first outbreak. I participated in elaborating MHPSS program in response to that outbreak. So for us, it seems like something very strange. That's the reason why when I was invited to, to participate in this in this uh, session with you, I thought maybe I will have something to share also with you regarding that aspect. So there is a gap between what we know and what we do in the current situation. That's the reason, that's could be, I'm not saying that is everything, but it's one of the things that we realize that uh, can be and is currently the main reason why we are seeing the spread of the outbreak continuing in the different location. We started from having 20% identified, but now we have 2,000, more than 2,000 people infected. So we are asking ourselves, what is the main reason of that? So this is not something new for you. This is not something that we are just trying to teach you how to know. This is something that you already know. But how now can we fill this gap between what we know and what needs to be done in order to mitigate the impact of Ebola outbreak in our communities? This is something that we are going to discuss, and then we are going to try to answer in the different slide that we are going to see. So my primary expertise is as Esther said, I'm a mental health specialist. So I'm designing a mental health program to be integrated in a global health response, specifically in emergency. And I participated in many emergency response, like outbreaks. When I'm talking about outbreaks, the last one was the mpox after the Ebola outbreak. It was the mpox, and also, this fever. I don't remember exactly the name, but this fever that we were talking about. So we elaborated different things around it. So this is one of the things that I'm doing. So all this aspect that we call psychosocial aspect of, or psychosocial impact of a disorder or a disease or a disaster. These are the things that, this is our main focus, because normally some health responders, or let's say some first responders, they don't pay too much attention on these details, but it can have a great impact on our response strategy, and then create some bias in the efficiency of or in the quality of service that we are providing, or the quality of response or support that we are providing to beneficiary in the affected communities. So this is the thing that we need to understand. If you have some comments or if you have some question, please feel free to write in the chat, because I'm not seeing the chat actually. And then when we will make a small pause, then we are going to revisit all these questions or comments, and then we are going to discuss together. So now, as I was mentioning, what is most important for us is what needs to be done, or what to do and what needs to be done, and what people should do. this is normally where everything starts. Because once we have the knowledge, once the situation is no more, let's say, something new to us, it means that we are not going to continue with, insisting on the outreach activities like awareness campaign. Of course, it is important. But in this, the content of this awareness campaign should change. So it should not continue to be, standard knowledge about Ebola, this type of things. We are talking about this. No, we should insist on what people need to do because it's not their first time to face this kind of situation. So they need to insist on it. So they need to collaborate with responders, with teams in health facilities and in the communities at the different level of intervention so that we can build an effective response. So it is not something that can be done by a single organization, not even by the Ministry of Health of your different or of the affected country, not even by health workers only, but by everybody, every actors. And when we talk about actors, we also involve the communities, community members. They are also part of it. So the first point, as I said, is what people should do. And secondly, why are there, we will also understand why this recommended practice can also face some obstacle because it's not because people are taught what to do that they will always comply. So there are different things that you will also have to deal with. We have religious, traditional barriers, sometimes cultural barriers. So it depends on the type of community that we are working with or that we are collaborating with. So it's not because you come with the best practice that can help a community, to face or let's say to overcome, the challenges that they are facing in this context of Ebola outbreak, that automatically they will comply with it. No. Sometimes even your children at home, you prepare the best plate for them, and all the nutriment, all the all the ingredient that you have put inside the plate and how it can it can benefit, it can be a good fit for their body, but they don't like it and they don't want to eat. And sometimes you have to force your children to eat. It's for their own good. No, I'm not saying that we are going to force the community. No, I'm just giving an example for you to understand. So it means that you can come with the best practice, but it doesn't mean that the community will automatically comply with so you will have sometimes to negotiate. Sometimes you will have to, to bypass, or let's say try to find a way to bypass the barriers. And then the last point is for frontline health workers. What can they do? So this is the point, as I was mentioning, how to lead the community to collaborate, to comply with the recommended practice. Because we know the recommended practice. The community needs also, sometimes they even know, but they are not putting it into practice. Sometimes they are reluctant to put them into practice. So we have to find a way to lead them to do it. And maybe when we have, I mean, find a way, I mean also finding the reasons what they are not doing it. You understand? Yes. And then, okay, so this is just a general overview about the audience of this session. So when I was preparing this presentation, okay, I have been told that These will be for the physician and nurses, for midwives, for pharmacists, co-worker, community workers, community health workers, clinical manager, and Catholic sisters. So globally, these are, but the way I design it is for everybody. As I said, all the different actors intervening in a context of outbreak. Because one of the things people one of the misrepresentation that people have about the different actors is that, okay, since we are talking about Ebola outbreak is a public health issue, so it means that the first people who are concerned about it are health workers. No, this is not the case. Of course, we have what we call a frontline health workers, but they are not working alone. They are working also under the guidance developed by, let's say, local authorities, traditional authorities. So there is a kind of system, surrounding and guiding what these frontline health workers are doing. So they are not defining what they do, so that, for example, in one community you will see them doing what they want. In another community, you see them doing. No, this is a coordinated response. This is a coordinated action. So there is a coordination in the way that they are acting. So they are following established standard and protocol in for the response to be efficient. So that's the reason why we have to call all these people together to work as one team, so that nobody will see that, okay, maybe nurses, their work is far better than what, for example, the midwives are doing, or the pharmacists, or let's say the managers or something like that. No, everybody has a role to play. But how can we bring them together in a coordinated way to ensure that what they are doing is, let's say, is for the good of the communities, and also uh, their response are also matching the quality standard. So this is a little bit what we need to understand, because sometimes what I've seen on the field is that, okay, no, people say this is a public health issue, we don't have something to do with it. You see, for example, military, or let's say policemen, or people in charge of, maintaining the order. They will say, no, this is a public health issue. It's like they are living in another place. Or it's like, okay, the virus will come and say, oh, oh, this is our policemen, they are not concerned about this. No, no, no. So everybody in the community can be an actor for the efficiency of the response, or can be an obstacle. And even inside the health facility, some people, because of their behavior, because of their personal representation, because of their cultural or traditional belief, yeah, they can also be an obstacle, or let's say a barrier, for people to have access to a quality service in this context of outbreak. So that's the reason why when we are mentioning frontline health workers, yeah, of course, it is the primary, they are the primary audience, but in the spirit of the idea is that, okay, they can also serve as relays, to establish a psychosocial network that will help everybody in the community, to feel safe and comfortable despite the 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 the, the situation. Okay. Oh, sorry. This is okay. Where's this presentation again? Okay. Okay, so there are 5 learning objectives that we have developed here. And the first one is the review is to review the key principle of infection prevention and control that apply to Ebola and many other infectious disease. And the second one is to understand why infectious disease outbreak continue despite widespread public health education. And on third point, we are going to recognize the human, social, and environmental factors that influence infection prevention behavior. And on the fourth point, we are going to reflect on practical communication and trust building strategies that encourage safer behaviors. And on the last point, we are going to recognize the mental health and psychosocial impact of outbreak on patient, families, communities, and healthcare workers. So these are the 5 points that we are going to see in this presentation. Okay, so this is just for your this is just a presentation for you to understand okay, what will be the different articulation of this session. So just in 10 minutes, we are going to see Ebola as a case study. And in the next other 10 minutes, we are also going to discuss about the infection prevention, a kind of refresher about this. And in 25 minutes, we are going to discuss about the real challenge, as I mentioned, why the outbreak continue. And after that, in the other 10 minutes, we are going to now evoke that important aspect that I've already I've already shared some highlight about it regarding mental health, how to keep a good mental a good mental well-being in this condition, in this context, and you will understand why this is very important. And then also the last point will be an open discussion. As I said, we are going to revisit your different question response. We are going to discuss about it just in an open way, and we are going to. I'm also going to. I will request you to also to share your experience with me, because even if I've covered Ebola response in the different countries like Liberia, DRC, I also need to understand how you see this situation and what is your personal experience about it. Okay. So this is about what we already know, or let's say, as I said, a kind of a review of this a kind of review of this disorder, and we are mentioning how Ebola is transmitted, and the first of all is through the direct contact with the blood or body fluid of a person who is infected. So this is one of the things that is really important to understand. So a direct contact with the blood of body fluid of a person who is infected or has died. Another aspect is the contact with surface, object, or linens contaminated by this fluid. And another aspect is also okay, it cannot be spread through air like flu or measles. And also, there is also a risk associated with it based on the different caregiving that you are providing, and also the traditional burial rite that people are also performing in the different community. So it's very important to understand this just as a general as a general knowledge so that people will know exactly how to deal with it. Because sometimes it's not everybody who knows exactly how it is transmitted and everything. So it's very important to always come with this and then discuss about it. So now about the symptoms and early recognition, we also have a kind of sudden onset, like fever, intense fatigue, you have a muscle pain, we have headache, we have sore throat, followed by vomiting, diarrhea, rash, impaired kidney and liver function. And the main advantage stage that we can mention is internal and external bleeding in some patients. And there is an incubation period of 2 to 21st day early recognition. So it means that early recognition can save life. So it means that when it is detected early, then people may have some chance to survive because normally they have their natural so it's not everybody who is going to die, even despite the fact that they don't receive, even if they don't receive a proper treatment for it. Yeah, there are situations that yeah, people may survive despite it. But it is clear that the level of lethality is, the rate of lethality is very high. That's the reason why it's very complicated for people uh, uh, to survive. And that's the reason why it's considered as one of the major concerns. Yeah. So actually, as I said previously, we were having a treatment and vaccine for the previous wave, but currently there is no. Of course, based on the different document, the update I heard from WHO, it's clear that there are some experimental treatment using, previous molecular from previous vaccines, but it is not official and it is not okay. So the protocol is not, shared on a worldwide base, saying that okay, this is a treatment approved by WHO or by Ministry of Health regarding this. No, for the moment there is not yet something like that, but people are just trying in the health facility to medicate the symptoms to keep people in quarantine, and then for the rest, yeah, it remains. But as I said, the one of the key is the early detection, the early investigation, and people may have some chance to survive about it. So there is also some monoclonal antibody treatment available for certain strain. Yeah, but this is not the place to talk about it, and I'm not even a specialist to discuss about it with you. There are some specialists and infectiologists. I think this is how they call it. They call them, who are specialists to give you more update or specific update about the current situation. So this is just a general background that we are doing on Ebola to, to establish the context of our discussion. Okay. So the moment that the person a case is identified, a rapid isolation is one of the things that will help definitely to, let's say, contain the spread of the infection, and also, let's say, increase, or let's say, guarantee the percent, or let's say, guarantee the survival of the person infected. So this is a little bit the case. And what is very important to proceed with rapid isolation is because it breaks the chains of transmission before it spreads, and also protect family members, healthcare workers, and the community. And then it also allow for earlier and more effective clinical care. And we are going to realize that this is what health workers, frontline health workers are doing in the different community. So this is a little bit the context where they are intervening and how they are doing things. And on the, on the other side, there is also lessons from recent outbreak that we also have. I've mentioned the previous wave of the outbreak that has been discovered and which serve as let's call it baseline or maybe experience to know how to face this current outbreak. So there is a community engagement, which is very important, and I've mentioned it because the community engagement, in case that we don't have a proper treatment, even if we have a proper treatment, we need the collaboration of the community for an efficient response to this outbreak. And one of the things that is also very important is that we realize that it's very important not to allow people who are grieving to manage their lost one or their family members who have been infected and who died from Ebola. It's very important not to allow them to manage their situation as they wish. So it's very important. It's very important. And also, it also allows us to proceed with a kind of to build trust with the concerned community, because trust is one of the key elements that we rely on in the context of Ebola. Community need to trust carers or health workers. It's very important. Without this, it's very important to, establish or even expect a community engagement or expect their collaboration. Because sometimes in the situation of outbreak, there are symptoms that people can, let's say, do mistake in the way of interpreting the nature of these symptoms. For example, I remember when I was in GRC, some people, they were having, a normal, how do you call it? I'm usually a French speaker, so sometimes my English is not so accurate. So bear with me a little bit about it.
You're
So,
doing great. You're doing great. Don't worry. And
yeah.
let's pause here just for a moment. And
Okay.
if anyone has questions, I think we are going very clear
Yeah.
on explaining, but it's a great moment to take a breather. Does anyone have any questions or comments so far for our speaker? I don't see any in the chat, so that's why I'm asking. This is, everything that Frank is saying, please understand how you can adapt it to your own context. I know that there's people that may not, be in contact with Ebola, but they may be in contact with other infectious diseases. So even, it doesn't have to be tailored, but it's how you can apply it to your own work context. For example, Lori, who just wrote in the chat, that this is a very important discussion and that you're doing a great job. She's in Haiti. She's not in Africa. So she has a lot of other infectious diseases that, that she will apply what you're saying to what she's saying, to what you're saying to what she's living in. So yes. But again, if you have any questions, please go ahead and put them in the chat and we will continue. Thank you. You can continue, Frank.
Okay. I was even expecting at this point maybe some because we are doing a kind of we are brainstorming the situation, and then I was also expecting maybe one or two people to share also maybe something that their personal experience about any response of of Ebola or something like that. But feel free at any time to raise your hands, and I think Esther will monitor and give you the floor just to share also what you
We
think.
actually
Yeah.
we actually have we actually have Sister Jane Francis. I believe she's in Uganda.
Okay.
May be wrong. Sister
Yeah.
Jane, go ahead.
Yes, thanks very much, William, for the information that you've given us. And I'm from Uganda, and we are neighboring Congo, where many people have experienced this outbreak, and some cases were in Uganda. So
Mm-hmm.
I'm working in a health facility, in a hospital. There was a lot of fear, getting news that people in the neighboring are suffering from that outbreak of Ebola. So all
Mm-hmm.
hospitals, radios started talking about it, and the nurses now, we are the frontliners. We get a bit scared. Every time you see a
Mm-hmm.
patient with high temperatures as a sign, you say, I'm in danger. I'm going to
Mm-hmm.
get Ebola. But what I have realized is that people are not always prepared for an outbreak.
Mm-hmm.
Only when we hear that there is an outbreak, that's when we put things in place. Like we order more
Mm-hmm.
of the protective gears, we put tents. I don't know your advice, because an outbreak comes like once in 2 years or in 3 years, and you can't keep like protective gears in place for all those years. Yeah, it comes and it shakes us, and we get into fears, especially we health workers. Yeah,
Mm-hmm.
that's what I can share, what we really experienced when we had there is an outbreak in Congo. So every health worker was on his or her knees praying that, we
Mm-hmm.
don't get one case. There is one case which we referred, and it wasn't. Yeah, when they tested, it was negative, but he was suffering from another fibroid uh, disease.
Mm-hmm.
Yeah, but what I have
Okay.
seen is that we are not always prepared.
Yeah.
Only we get to know. That's when we start fidgeting.
Mm-hmm.
That's what I can share in Uganda.
Okay. Thank you so much. I remember I also visited Uganda. I've been in Kampala and also Mombasa, so a very beautiful country. And I know you are also sharing, some similarities with East region of Congo. And it is clear that even with the current situation, your country need to be on alert with this. Otherwise, it will be who knows? Because as you are sharing a border with DRC, when a country is facing, that issue uh, 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 with an outbreak, you should also take it seriously. And talking about border, you will realize that even many countries, even who are not directly linked with DRC, but because sometimes, we have travelers moving from a country to another, they are also taking it very seriously. I'm talking about Egypt, I'm talking about Sudan. They are also, the level of alert in these different countries is also very high due to, the movement of population uh, 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 going and moving on on the two sides of the borders. And even you see, I remember when I was seeing the news that the United States, they are very strict also regarding travelers coming from DRC. And currently, I know in Kenya, for example, there is an issue with the quarantine place that has been established, to receive some American citizens who were also acting as responder to this crisis. So it means that outbreak is not just a matter of clinical issue, but it can also become a social and political issue. So maybe these are things that we are going to discuss further in the other. Yeah. So if we already know how Ebola spread and how to prevent it, why do outbreaks continue? So I told you this is one of the main points. Why do we continue to have, the continuation of outbreaks in the DRC and also in different other countries, despite all the sensitization, all the resources that we put in place in order to, to make sure that the situation can be contained. It's not because people are not aware about Ebola. It's not because people are not aware about what what need to be done in order to protect themselves. It means that in the way of responding, or let's say in the way of acting effectively to protect themselves, there is a gap. And this is something that we need to address. So now we are going to do a kind of refresher on the infection prevention. And this is to reinforce the practical principle that every frontline health workers can apply, when they are facing. So this is a little bit what we call the standard precaution that everybody should know. Sometimes in some health facilities, you will see that it is stamped. I don't know if the word is correct, but you will see it sometimes on the wall of some health facilities, a kind of refresher to remind all the people, not only the health workers, but also the patient and also the carer in the different health facilities, to know exactly what they have to do. So there are key measures, for example, specifically, because in the context of outbreak, remember when I was telling you that outbreak can also bring a confusion in the way that we are managing the normal, and I don't want to say normal because no disease is normal, but in the way that we are managing the other kind of disease that are part of tropical disease that we usually have in our context. For example, flu, pertussis, meningitis, tuberculosis, measles, chickenpox. These are the things that are very common to see in tropical context. But the particularity of Ebola can also bring a kind of confusion, so that people may, they can do mistakes when, for example, it comes to investigate flu. They can take flu like something related to Ebola. They can treat tuberculosis like something related to Ebola. They can treat measles, chickenpox like something related to Ebola. So everybody even health workers, sometimes when they will say, oh, this is Ebola, because there is an outbreak of Ebola. So the importance of having sometimes this standard precaution is to guarantee the safety of people, of health workers, of patients, despite the type of disease that they can suffer from. So, for example, you will see that in all care situations, you need to have hand hygiene to put in place. Hand hygiene as key measure. Protection equipment need to be established, and a safe handling of sharp object need also to be to be part of the key measure to put in place. But now, about the contact for Ebola, you have your gloves, you have gown, you have hand hygiene, you have dedicated equipment specifically for Ebola. For flu, pertussis, meningitis, about the droplet, you have the surgical mask, you have the distance that we put in place, we have the respiratory hygiene that are considered as key measure. And for airborne, the protection concerning this type of protection, concerning this disease, tuberculosis, measles, and chickenpox, we have the FEPP2 mask, we have the negative pressure room, we have the ventilation. So these are the general standard that key measure that you will see in every health facilities that despite the low resource that they have, they will try to put it in place. Otherwise, it will not be possible, to provide any single or any type of response to these people. So now, let's go deeply in the heart of this session. Why outbreaks continue? Let's say before we go into that, I will want to ask 2 or 3 people, why do outbreaks continue despite, all these prevention, all these outreach activities, all these awareness sessions that we put in place? Based on what you are facing in your own community, in your own country, or in your own community, what could be the reason why we see a continuity of the spread of this outbreak? I just want to 3 reaction, and then this is just for me to take a
And it's
small
yes, and it's a great opportunity on what, listening to our audience and what they face every day. So yes, we invite anyone who wants to come off mute and just answer the question. Why do you think outbreaks continue to happen? when when there's a staff that knows what to do? What are other factors that contribute to outbreaks happening? It doesn't have to be Ebola, it can be any outbreak. So Lori says in the chat that when cholera first came to Haiti through the UN peacekeepers in 2010, many Haitians hadn't had even heard about it. So it took several weeks to get the information out. I'm sorry, I'm gonna mute everyone while I'm speaking, but then Sister Priska and Sister Jane can go ahead and speak. So it took several weeks to get the information out. As many died, the population spread the information quicker, and many changed their behaviors. Yet some didn't believe and didn't change their behaviors. The main thought was that the Haitians are resistant to many bacteria and cholera will not hurt them. Despite all those settings, and I lost where I was reading. Despite all those getting ill and dying around them. They knew the information, but they didn't apply it because they didn't believe the information. Some contributed to it to politics or foreigners. It only took a few who didn't live by their recommendations to continue spreading it, which is also a big part of the problem. We tried to use peer pressure to force better hygiene. It would work for a short time, but then people would fall back into their old habits. This continues to be a problem for us, and we continue to try to find good strategies. We don't have any good answers, but we like this discussion. Thank you, Lori, for sharing those thoughts. This will help us think about it more clearly. Sister Jane, you wanted to say something? Yes, go ahead.
Yes, please. I was looking at countries which are more affected with the outbreaks, especially with the Ebola. I could say that countries should really put strong laws and policies to be put in, to stop people from eating wild animals, because now we have to look at the original source. The scientists, they say that the origin of this Ebola is from wild animals, people eating wild animals or coming in contact with bats. Maybe laws can be put in place to see that all households, they don't have bats, or all people should not really eat any wild animal because that is the source. I don't know how the government could put it. Then another thing with health workers, for sure, we are told all the measures to wash our hands, to put on protective gears when attending to patients. As you've already said, we tend to forget. When there is no an outbreak, we tend to forget and we go into our usual way of doing our things, and which is not very good. In hospitals, they emphasize health workers to wash their hands every time, every hour you come in contact with either patient's beddings or in contact with a patient, you have to wash your hands. Or after tending to each patient, you have to wash your hands. Maybe in our health facilities, there could not be running water, sufficient running water in our health facilities that can help us to wash our hands on every station where we are serving. I think we tend to forget, or we don't have a source of water, the running water in our facilities. Instead of moving, going very far to wash your hands, and we tend to ignore. But we can have the pockety antiseptic to use as we do our daily procedures. We tend to forget. That's what I can say.
Yeah. Thank you. Thank you so much for your reaction. And you have mentioned one of the points that is, I think, is really crucial. And this is something that we sometimes forget. The routine. At the first level, let's say at the first, during the first phase of the response, like for example, the 2 first weeks of the response, you will see people are very, strict in the way that they are behaving. They take all the caution with the way that they are managing different cases. But as long as, there is a continuity of the outbreaks, their level of alert is also slowing down. It is slowing down to the level that they consider things as normal. And you will see that people will start to relax, and then they are not going to pay. This is one of the common issue that we realize in health facilities or in response in general. You realize that people may say, "Oh, this week we didn't identify any case, so maybe Ebola is dying or Ebola has started to go." This type of things is because the response, or let's say the outbreaks, is taking a certain time. If it was just, a 1 month outbreak, for sure, everybody will be focused. But when you see it start to be 1 month, 2 months, 3 months, yeah, even people become, and sometimes when you also see a lot of case of false identification, where you were thinking that, okay, this case is Ebola, but after investigation, after diagnosis, you realize that it's not the case. So we say, oh no, I was just misinterpreting my result. And this kind of mindset will lead you to raise down your level of alert. And this is where you are more in danger. I remember when I was doing a similar session with some health workers in DRC, I was telling them that, okay, this is the moment that you think that you are safe in the context of outbreak, is the moment that you are more exposed. Because the moment that you think, it's similar to even, a conflict context. The moment that you think that, okay, I'm no more affected, rebels are no more around, war is finished, the conflict is over. It's at that moment that you are the most exposed. Why? Because you will slow down, you will start not to respect, you will start to neglect different things, and this is where you can be affected. So during an outbreak, we should learn that no matter what, as long as the Ministry of Health has not yet declared the termination of the outbreak, you have to maintain. That's the reason why it's very tough. And in the organization of staff response, we need to put in place mechanisms that will help people not to stay too much in the context of outbreak. Otherwise, they will expose themselves. Yeah, but these are the things that we are going to see at the end of, yeah. So I told you that we are going to talk about things that are not directly linked with the virus of Ebola, but that can constitute an enabler of the spread of this outbreak. The first thing is fear. When people are experiencing fear, these are the time that they are taking the worst decision because of fear. Because of fear, we are making errors. Because of fear, sometimes we may like to, hide symptoms, be in a kind of denial mode. Like, okay, no, I don't recognize this as a symptom. We have seen it during the COVID-19 when people were saying that, oh, no, I don't have COVID. I don't have COVID. No, I don't have. This is just a normal flu. I don't have COVID. So you are hiding symptoms. You are not. You don't want to recognize them as what they. You don't want to recognize it as what it is. And when you don't recognize it, then you are going to avoid even treatment center. And you are going to avoid because of the fear that you can be separated from your family. We have seen it in DRC. People were running away from hospital because they were thinking that, okay, no, I think I'm not, I don't have Ebola. Why do you want to take me in quarantine? I'm going to die alone. So they start to have this kind of. So this is what fear can lead people to do, and which indirectly can also open many other doors. Because when you leave the treatment center to go and find and seek refuge with your family, you are going to expose them to an infection. You see? So fear is something that we cannot neglect. And as I said, it will delay the care seeking and drive hidden transmission that surveillance system cannot see. When you hide yourself, when you are running away from people who can investigate your case and give you the appropriate solution, automatically you will expose others. And this is how you are going to. I remember one patient we had particularly in Beni. Beni is a locality, is a town of the North Kivu. I think it's even the capital of the North Kivu. No, I think the North Kivu is Goma, the capital. But Beni is also one of the another important town in the province of North Kivu, in east region of DRC. So that patient came to the health facility, and the doctor who was investigating his case realized that he was having many symptoms related to Ebola, but the case was not yet confirmed. But because the doctor told him that, I'm suspecting a case of Ebola, maybe we need to put you in quarantine for observation. But since he heard about Ebola, when he went with the nurse to the quarantine room, yeah, he was so complying that people were not even imagining that he can run away. But as long as the nurse just turned away to go and, manage some other patient, he discreetly left the hospital and ran away to his house to say, okay, now, people want to, yeah. And this is how, after a couple of weeks, we realized that, okay, we heard that this man was dead, and his wife and his two kids also started to have the same symptoms. But you see, if he was not experiencing this fear and decided to stay, and that time, unfortunately, that time we were having the vaccine. So if he stayed at the hospital, he could have recovered from it. But because of fear, because he left, then unfortunately he died. So this is just an example. I have multiple examples like that. That's the reason why, just to show you the importance, or let's say the importance of what fear can do in the context like this. There's another thing called stigma, because fear, stigma, it works together, because they work together. Because one of the aspects, why are people experiencing fear? They are experiencing fear because of let's say the way that people are going to are going to see them in the community. They don't want to become, to be pointed like, okay, you see this person is sick, this type of. That's the reason why people, they hide themselves. And sometimes even health workers can experience rejection, because the moment that people know that you are working in health facilities or in a Ebola treatment center, they can also say, no, 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 we are no more safe around you. And then they can even run away from you, saying that you have the disease, despite the fact that they don't even have a single. And we have seen, I remember one of the nurses that people in his community were spreading rumor on him, saying that he has Ebola. And as health workers, sometimes you can also experience tiredness because of the workload that you have. And the moment that you start to feel weak and to say, oh no, I'm not feeling well, automatically people will say, oh, maybe you also have been infected. And automatically they will start. So stigma is another aspect that can also create an obstacles, because it's also discourage people from getting tested and or reporting symptoms for fear of judgment. For fear of judgment. So you see, stigma is associated with fear. So these are working, they are working together. And you remember, I told you that one of the things that an outbreak is also breaking is the trust. I heard during the time that I was part of this response, people were saying that, okay, the moment that you will go to the hospital, people can even inject you the virus of Ebola because they want to make money on you. Mm. And I know many of you, for those who are working in hospital, I know that you also heard this kind of rumors, or maybe of misconception that people are raising in the community, saying that, okay, no, it's the moment that you go to the hospital, because they say, no, Ebola is something that is manufactured in laboratory by white people, and then they are going to inject it on us in order to kill us. This complotist kind of thought. And when they bring it in the community, then it becomes something very complicated to manage. So one of the things, apart from fear and stigma, one of the things that is very complicated for responders to establish in the community they are working with is the trust. That's the reason why, and to build trust is not something that you can just accomplish with your words. No, it is based on your, let's say, the permanence of your behavior toward the community, the way that you behave with them, the way that you try to push, to to build a comfortable weather where they can feel safe and calm. And this require a lot of work. It's not something that you can just say, oh no, I'm the right person to support. No, no, no. It's not like that. It's something that you need to build with your own it's something that you need to build with your own skills. You understand? So they are the community are more likely to follow guidance from people they trust than from those who simply provide information. So it means that as responder, it's not just what you say, it's also who you are. Are you a person that by your behavior, by the way that you interact with the community, you can lead them to, or you can inspire trust or something like that? Yeah, then they are going to follow what you say. So you see, for a responder or for health workers, you also have to manage yourself to present yourself as a person that the community can trust. Otherwise, it's not going to work. Then now we are talking about another aspect that constitutes a barrier. And this is one of the toughest. I don't know if I'm correct, but it's very tough when we reach this aspect of cultural practice. Cultural practice in Africa in general, it takes a very big aspect in the life of people in the community. A very big part, if I can say it like that. Yeah. And people trust more their cultural practice. They have more trust in their cultural practice than what a health workers can tell them. I've seen some people refusing to take medicine because they say, okay, my traditional healer told me that this is not going to help me, or my religious leader, my pastor, or my priest, or my told me that this is not going to help me. I'm believing in my miracle or something like that. I'm not saying that cultural practice is something bad. No. But in case of outbreak, you need to comply also with people who have this strong belief in their cultural practice. And sometimes it's not something easy. And when we talk about cultural practice, some people may say, no, we cannot bury our brother or our sister or our child like this because he was having, because he died from Ebola. We need to ensure that he receive all the big funerals and all the traditional clothes or everything, all the rituals that we are doing to ensure that his soul may rest in peace or will go to God or something like that. You see? And this cultural practice is also exposing them because the way they are managing, they are washing the body of the dead person, and they're putting clothes, traditional clothes, and all this manipulation is something that is also exposing them to the infection. But no matter what you are going to tell them, it's very difficult for you to tell them that no, because this person died from Ebola, you cannot. And I've seen some family going secretly to do all this cultural practice because they were thinking that, oh, it will be complicated for our lost person to, cross the river. Cross the river. This is the term that sometimes traditional people who are very traditional that they are using. Oh, it's very complicated for this person to, you know, to go to the heaven if we don't do this. So no matter what you do, they will try to do it. So it things is to learn how to manage with them, help them to do it in a safe way. So unfortunately, as health responder, or as a responder in Ebola outbreak, we will have to involve ourselves in cultural practice, no matter if we believe in it or not. But for the sake of containing the outbreak, we are not going to have a choice. It becomes very complicated. So now, another thing is to work with community, not against them, as I'm mentioning. Adapt practice rather than banning them. So this is what I'm mentioning. And also involve religious and traditional leader as partner in the dialogue. It's very important. Otherwise, I don't see how you are going to manage. When I was working with World Vision in DRC, in communities, churches were constituting a very big partner for us in our response strategy to Ebola, and they played a very crucial role. So priests, um, uh, 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 um, sisters, religious sisters, they were part of the response as main actors because people listen to them in the community. People have trust in them in the community. So they were playing a very crucial role in our response strategy, not only to, let's say, help people to, to comply with the protection measure, but also in the way of doing their cultural practice, funerals, sometimes when they do, they organize the grieving, all these type of things in a safe way so that people were not exposed to infection or something like that. So I'm just raising the importance of having this resource. I mean, traditional religious and traditional leaders as partner in the response, not as obstacle. But in some case, if they are not sensitized, they themselves, they can constitute a barrier. Because if the religious leaders say, "Oh, no, this is a curse from Satan," let us just pray. And I think God is going to protect us. We don't need, to take this measure. We are covered by the blood of Jesus or something like that. Yeah, automatically people may believe. And then they will say, no, we are living by faith, not by what we see. And this is how they can. So religious and traditional leaders, they need also to understand and be partner because their word has a weight. So if what they say themselves and what they believe themselves can also affect what people in the community believe and say, you understand? So it's very important. So in context of is somebody saying something?
They there's been some great comments in the chat about
Okay.
precaution and hostility in the communities, and also the overloading of information when trying to explain to a
Mm-hmm.
person about the different diagnosis, symptoms, prevention, that people may get overwhelmed with the information and so they stop listening and how to um
Mm-hmm.
yeah. So
Yeah, this is
there's been
very
great
important.
comments.
Yeah. Yeah, this is very important. This is very important to mention because we have to be concise. I don't know, Esther, if your English is better than than mine. Concise in the way
Hmm.
that you are spreading information, so that we are not going to take a book to say, okay, let us come and read it. No,
Yeah.
it's not going to work like that. So it's very important. Short messages, going straight to the point, and in simple words. Don't come and say, Ebola, you give the scientific the scientific name of Ebola, it comes from this virus. This virus is called no. People, they don't need to know all this. But the essential things that we can share, for example, what we are
Hmm.
talking here, like in context of limited resource, we can provide soap, clean water, protective equipment. isolation space, staff, and we also need the time, because time is also one of the resource that sometimes we are lacking in low resource context, if I can use that aspect. Because in some community, even to have clean water to drink is an issue. So how do you expect them to have clean water to always wash their hands? They can consider it as a waste of resource. And sometimes, some contexts, people are so poor that even the health facility doesn't even have a normal room for patient. People are just, lying on the ground. I've seen it in some health facilities, in some health unit, if I can say. I cannot even call them health facilities. Sometimes people are lying on the ground. Sometimes there is just a piece of cloth or a piece of blanket, putting a separation between the consultation room and the hospitalization room, just a blanket. We have seen it because it's very, yeah. And in this context, it's very difficult to proceed with recommendation or something that you say, okay, there's something. But these are the minimum resource that we need to have when, for example, we want to establish, let's say, a minimum response to an outbreak. Is very important. So no matter what kind of things that we are facing, it will be very complicated if we don't have at least this minimum. It will be a barrier if we don't have all of this. Soap, clean water, protective equipment, small time, staff, isolation place. Yeah, so these are the minimum resource that we need. But if we don't, then there will be this will be a barrier to the efficiency of our response. And also, we also have economic pressure and misinformation. I think we have already discussed about it. Of course, the majority of site where you will face, you will see the spread of the Ebola outbreak. They are the place where poverty is very high. Own protection and also their own hygiene. So it becomes very complicated. Also, misinformation and rumor. I've already talked about it. I don't want to, for the sake of time, I don't want to bring
Yeah,
other things.
I want to, Sister Jane shared a great example on the chat. She said that during the outbreak brought a lot of chaos. For example, relatives wanted to pay the last respect, and health workers who were responsible to bury the victims and stop their relatives from paying the last respects. They were actually bidden and driven out of their communities. And the relatives continued the ritual of opening the coffin to pay the last respect. So that's a great example of what we've been discussing about cultural practices and establishing trust.
Yeah.
Yeah.
Yeah. So definitely this is exactly what we are saying. And yes. So this is exactly what we are seeing on the end. It's also part of so now, to be effective, because we have already revisited all the different aspects in terms of resource, in terms of knowledge, in terms of barrier. So now there is something that we need to do. And that things start not only by bringing, a lot of, as I was saying during a meeting, no, it is not in the situation of outbreak. I think money and the materials come in second position. Behavior and let's say representation that people have about the outbreak is something that need to be considered first. Because if you bring money to people who doesn't have, in terms of behavior, they are not complying with, restrict the minimum uh, 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 the minimum standard that we expect from people who are living in a community in this in community affected by outbreak, then it will be very complicated. So, as we said, knowledge alone rarely change behavior. So why do people continue risky behavior even after receiving health education? What communication approach have been most successful during outbreak? And what have you learned from your old field experience? So this is where I was expecting us to have a discussion about, these three before the end of this presentation. I wanted us to discuss about it because, of course, I can share with you and I will, but I also want to learn from you. What do you think in terms of communication approach could be could be the most successful during the outbreak? We have seen that, okay, I was talking about it and I will start. Why do people continue risky behavior even after receiving health education? And I told you during this presentation that maybe sometimes it's because they are living in a very poor context. That, for example, for them, changing their behavior can also affect some other aspect of their life. If, for example, you say, okay, when people are, if my job is to build coffin, coffin is, yeah, there are some people who build coffin and then this is where they use the kind of materials that they use to bury to bury corpse. And there are some people in the community who are specialized in providing, what you call last salute or last greeting or last goodbye to their community. There are some things like that. There are some people who give, in the community, they receive payment for that to organize funerals. There are some traditional leaders who are specialized in providing this. So they are receiving money for that. There are some other people who receive, for example, when you will say, okay, you will put them in quarantine, they will say, oh, if I stay in quarantine, I'm a trader who is going to provide food for my family. So I cannot stay for 21 days in the quarantine for you to observe if I'm infected or not. I will have to go, I have to work. Some women will say, if I stay here, I don't go to farm, then my children will die because we don't have the food that I'm taking to my family comes from my regular visit in my farm. So you'll see these kind of things will create a very complicated situation where people, because of their survival, can adopt risky behavior in the context of outbreak because they cannot do, they cannot change it. So now, for you, what communication, suppose in this kind of situation where, we live in a community where people are experiencing they are living in poverty, what kind of communication can you uh, address to these people that can be successful for them to understand? This is the first question that I have for you. And what have you learned from your own field experience for those who already or who are currently responding to this Ebola case? I'm not uh, talking about clinical experience. And if you want to share clinical, is good as well. But is mostly in your interaction with people in the community. This is what I want to hear from you. So for the sake of time, we are just going to take, let's say, 2 or 3 examples, Esther, and then we will move forward. Yeah.
Yeah. Yeah, I think there's no other messages in the chat, so and
Okay.
we've already passed the allotted time, so it's better to move on.
Yeah. Okay.
But I don't mind. I know that the students probably don't mind the pace that you've been going at and what we've been discussing because it's been very, very informational.
Mhm.
And for the participants, please know that we are reaching the end of the event, and
Yeah.
that we will definitely send out the recording afterwards. So if
Yeah.
you do have to go, it's okay. But now it's,
Yeah.
I think now it's a great this is a great closing because it's how can we support mentally mental health support for everyone who is involved in these processes.
Mm.
Yeah.
Okay. So just in 2 minutes, so this is an impact. So when we are talking about the psychosocial effect, first of all, we have the patient. We are discussing about fear, isolation, and uncertainty, and for family, what they are experiencing is separation, grief, and disrupt caregiving. For survivor, is stigma and reintegration challenges, and for health workers, is stress, burnout, compassion fatigue, fear of infecting family, and moral distress. So, so the success of outbreak control depends on more than science, as I was explaining at the beginning of this session. So it requires strong infection prevention practice, effective communication, trust, compassion, and an understanding why people behave the way they do. So it means that you should have you should be open and flexible in the community when you are dealing with this, because it is not everybody who have the same even if they are in the same community, each case is different. Sometimes managing a case of a woman who is a widow who doesn't have anybody to support her kids and she's infected will be different than managing the case of somebody who has a full family support. So, but as responder, we need to be flexible around all of this in order to not putting some people in a very, let's say, increasing their level of distress because we are focusing on the containing the spread of the outbreak. So the presentation will be shared with you just to I don't expect you in 1 hour to to get everything, but you can read and maybe address your future comment or let's say question to uh, to me. I think Esther, you can share my email and also my contact with participants. In case of need, we will have I can bring additional information and or even share resource about Ebola that we have developed with in collaboration with uh, many organizations and WHO. So thank you so much. I know 1 hour sometimes is very
Yeah,
is
it's very
very
short.
very short.
I will, if you permit me, I will definitely share your
Yeah, yeah,
email
yeah,
address
definitely. You can.
with the participants.
Yeah, yeah,
Yes.
I'm open to that.
Thank you. Thank you so much for this very enriching collaboration. I see that there's, and I just closed it, but I see that there's people that are saying thank you in the chat for your presentation. Uh, Others are saying that the washing of hands reduces other infectious
Mhm.
diseases, and that, to promote community education with those that survive these diseases as well, so that they can, provide testimony. So this has all been great. I look forward to drafting that recap email, and I'm also going to use some of the comments in the chat to write that email. I want to start by thanking you, Frank, for sharing your knowledge, experience, and the many practical lessons from your work around the world. Thank you also to everyone who participated, who have shared their examples, their reflections, and experiences. Today's discussions reminded us that successful outbreak response depends on more than medical knowledge and technical guidance.
Yeah.
Because I think this is what I took the most out of your presentation, because it requires trust. Not only
Yeah.
effective communication, not only prevention practices, but
Mhm.
that community trust, that when we
Mhm.
are addressing the patients and the families, that they trust us. And this
Yeah.
is something that we have also been discussing in our leadership in practice webinar series, where we're talking about how do we develop community trust. So I think it's great that you emphasize that today. Um, we hope that you leave today's webinar with practical activities that you can apply in your communities. Um, and again, thank you, Frank, and to all of you for your commitment to serving others. We hope to see you again in the future. Have a wonderful day. And if for the last, as a last practice that we always do, if you want to come off your camera and we can take a picture and mark this webinar, have a little picture of everyone who joined, that would be great. I'm going to give a couple of seconds because I know that networks can be slow. And again, I appreciate you staying on with us for longer than the expected hour. That means that it was very good information and that we were engaged with it. So I'm going to do this in about 1, 2, and 3. Thank you. Thank you so much. And I will see
So
you
by the way,
all.
these are not sunglasses. These are my regular glasses because sometimes people may think that I'm just enjoying my summertime. No, these are regular glasses. So it's my for my eyes for the light because
Yes,
my eyes are so sensitive to the light.
I understand. Thank you. Thank you so much. And we will see you soon. Thank you.
Bye bye.
Bye bye.
Bye. Bye.
Bye bye.